Right there, little bitch.
Toodaloo!
Hola, AJ.
¿Cómo estamos? Bien, gracias. ¿Y tú?
How's it going? My name's Shane.
I'm
I'll be your nurse for this video.
Awesome.
What is your name?
I'm AJ.
AJ. Nice to meet you.
Nice to meet you.
Purpose of this video, I'm going to be doing a chest and abdomen assessment. Do you have any questions about the procedure, AJ?
No.
So basically, I'm just going to be listening, doing a little touching, feeling, and kind of seeing if you're healthy as could be.
Okay.
All right. So I would provide privacy. I would wash my hands. Then, just based on visual appearance, I would say I'm assessing AJ's chest right now. He has equal rise, equal fall. There's no unequal. I don't see any retractions or anything like that. So we would continue on. Let's see here. All right. So for right now, I'm going to assess AJ's anterior-posterior ratio. So you're good. You're good. Okay. AJ's pretty broad shoulders. So I'm just using my hands as kind of a little guide measuring. So we got probably about 30 inches,
wide.
I guess.
35 wide.
Then back. So we're about this far back, and you can tell. So I'd say it's adequate 1-to-2 ratio. So we're good there. No barrel chesting going on. Let's see here. Gonna palpate AJ's skin.
Brown.
He's warm to touch. He's not overly hot or anything like that compared to I am, as I got sunburned over the weekend. Okay, so AJ, I'm gonna have you spin around here for me. So I'm going to use my stethoscope. I'm using the diaphragm portion of it. I'm gonna go in a Z pattern across his chest. For the sake of the video, I would auscultate anterior, posterior, and laterally. When we get to the pulses, I would assess bilaterally, but for the sake of the video, as I say it for the 5th time, it's just gonna be unilateral. I'm just gonna do one side. So we're gonna continue on. So as I auscultate his lungs, I'm gonna have him do EEE to, what is it? Egophony?
Yeah.
To assess for egophony, a positive indication would be if I hear an AAA, as he says EEE. So let's get to it. So I'm gonna have you breathe in, deep breath in through your mouth. I'm gonna have you say EEE on your way out. So breathe in. And out.
E.
Good.
E.
Continue down.
E.
2 more times.
E.
And last one. Thank you. So as I was auscultating, I didn't hear any crackles, wheezes, rails of that sort. I did not hear a positive indication of egophony, which would be that AAA. All I heard was EEE. So it looks like we're good there. So I'm going to continue on. I'm going to assess for tactile fremitus. I'm going to go down the center of his spine while he says 99, 99, 99. All right, if you want to.
99, 99, 99, 99, 99, 99, 99, 99.
All right, you good. So I heard equal vibration bilaterally for the sake of that assessment. I did not feel any abnormalities of that port. I don't really know what the abnormalities would feel like, honestly, so it's good to have a base assessment for me continuing on. While I have AJ's back towards the camera right now, I'm going to assess for the CVA. So I'm going to put my hand kind of over AJ's lower back here, and I'm going to kind of punch my hand, if you will. And I'm just assessing for any tenderness or pain with AJ. All right. Any pain?
No. Ow! No, just no pain.
Okay.
No pain.
So that concludes AJ's chest assessment. I'm going to have him move over to the couch and we're going to continue on. So we moved over to the couch. I'm going to have AJ lay down for me.
AJ, huh?
AJ.
Hey.
So to start off with, I'm going to palpate for any heaves or thrills across AJ's chest. I'm going to just go about the 5 points, apical, pulmonic, Erb's point, tricuspid, and mitral valve. So I'm just going to palpate those and see if I feel any thrills. The only time I feel the thrill was dialysis patients in their forearm there, so that's kind of what I'm referring to for this. So far, I don't feel any heaves or thrills. So I didn't feel anything. So I'm going to continue on. I'm going to use my stethoscope here, and I am going to auscultate those points as well. First one's going to be the aortic, like I said, so it's going to be the second intercostal space. Let's get down here through all your muscular tissue.
Attaboy.
Sounds good. Move over to the pulmonic valve. It's going to be second intercostal space left of the sternum. Good. Move down to the Erb's point, which is the third intercostal space. Down to it as well. Move down to the fourth intercostal space, which is going to be the tricuspid valve. Move over to the fifth intercostal space. It's going to be the mitral valve.
How's it sound? How's it sound?
I'm able to hear the S1, S2 low dub. So for S1, I heard it the loudest over the apex,
Yeah. Yeah.
which is the mitral and tricuspid valve. I heard the S2 sound loudest over the base of the heart, so we have the aortic or pulmonic valve. So let's see here. So I'm gonna palpate for pulses. Like I said earlier in the video, I wouldn't palpate usually bilaterally. Actually, I would palpate bilaterally. For the sake of the video, I'm gonna palpate just unilaterally down AJ's left side here. So we're gonna start off with the temporal pulse. It's nice and strong. We're gonna move down to the carotid. This one you wanna palpate deep and hard.
Get in there.
I'm kidding, light palpitation. Good. Continue on to his brachial. Move down to the radial. He just got his little healthy Fitbit on.
Trying to lose weight, you know.
That's good.
Heart health.
I'm going to continue down to the posterior tibialis. Then the dorsal pedis pulse. Just kind of right here on top of the foot. So the pulses I would grade were +2. They weren't overly strong. They weren't bounding. They weren't easily obliterated. They weren't obliterated, and they weren't threaded.
I love liver.
So, I think that's it. Right? Yep, that's it. So we're gonna continue on. We're gonna do his abdominal assessment here. All right. So we're gonna continue on to AJ's abdominal assessment. So I'm going to come down here to his level. So I'm going to inspect his abdomen before we continue. I can tell it's flat, no distension, no sunkenness. It's symmetric from what I can tell. Just take a quick glance. I'm going to do a little skin temperature. A little bit cooler, but it's not overly cold where I would be concerned. I'm going to continue on to auscultate the 4 quadrants of his abdomen here. Listen for any gurgles and clicks. When was the last time you ate anything?
This morning,
How long ago?
9 a.m. So, 4 or 5 hours.
It's been about 3 hours since he's ate anything.
3.
So his upper left and right quadrants were a little hypoactive. I only heard probably about 1 or 2 clicks as I was listening to him. Any clicks less than 15, I believe, would be considered hypoactive. He had normal vowel sounds on the lower left and right quadrants. So as I move on, I am going to do a little percussion through the 4 quadrants. So I'm going to go across the upper left. I'm listening for any dull sounds. Hear anything? Dull sounds would indicate masses potentially or pregnancy, which I don't think we're good on that part. We don't have to worry about that. So I didn't hear any dull sounds and sound normal to me on my auscultation, or I guess percussion, sorry. So let's move on. We're going to do light palpitation across the abdomen. I just want AJ to let me know if he feels any pain or tenderness as I'm moving down across. So I didn't feel anything. Did you have any pain with that?
No, just got pee.
So no pain. I'm going to continue on with deep palpitation. I think with deep palpitation, I would be able to feel if the patient had like any abnormalities with like the spleen or liver. So, any pain?
No.
Okay. What else? I think that's it, right? Yeah. So that's gonna be the end of my chest and abdomen assessment.